transparency and honesty. At 2:45 today, we got confirmation of our first case of coronavirus from CARFA. Let me give you a brief history of what has happened so far. This case, should be noted, is an imported case. It's a 52-year-old male who flew into the country from Switzerland on Monday, the 9th of March. That is this Monday. It is worthwhile to know that since Monday, this person has been in self-isolation. The person would have contacted his healthcare professional on Wednesday, the 11th, which is yesterday. The necessary swabs were taken, and CARFA today at 2:45 p.m. contacted me and said we have our first confirmed case of COVID-19. What have we done so far since we were alerted about this possible case? As I said, he came in on Monday night. The family has been in isolation since we were alerted, since Wednesday the 11th. Contact tracing began on Wednesday, already begun, under the protocols that we use for tuberculosis. This is being conducted by Dr. Michelle Trotman of the Cora Hospital as a matter of course. So contact tracing began on Wednesday. It is a mild case, so now arrangements are being made to have the patient transferred from his home via suitably equipped ambulance services with all PPE to the Cora facility, as it is a mild case. The issue of patient confidentiality has to reign supreme, so I'll be unable to share much more details about the patient. What is important is that the government, via its different spokespersons today, myself and Minister Young, are sticking to our words to be transparent, honest, upfront, and timely with the information. Thank you very much.
Good afternoon, members of the media. As you've just heard the Minister of Health announce, Trinidad and Tobago has the first case of imported COVID-19. You've also heard him say some very critical points, which including that the person self-isolated upon entry into Trinidad and Tobago, and upon contacting the family, he came in on Monday night, self-isolated on Tuesday. Upon contacting our medical health personnel on Wednesday, the family have then been quarantined. What we want to emphasize is exactly what we've been saying all along, and including what was said as today's post-cabinet press conference. The government continues to be very fluid and monitoring the situation, monitoring other situations, meaning what is happening around the region, etc. And we ask people to continue to follow the advice that we've done. The Ministry of Communication later on today will be putting out basically a fact sheet setting out all that we've spoken about. What we're asking people to do is continue to be self-cautious, continue to exercise caution, and not expose yourself in unnecessary public gatherings and these types of things. We will continue to monitor the situation. Again, we thank and congratulate the Ministry of Health and its personnel, the Chief Medical Officer and his officers, who have been doing a fantastic job. As we had told you all, we did have the meeting with all of the interministerial team, with the Trinidad and Tobago Police Service or Defence Force or Airport Authority or Ministry of Education, Tourism, Communications, and various ministries were present earlier on, and our planning continues. The protocols have been implemented, the tracing is taking place. National security will continue to play the supporting role as we've been doing, and as and when necessary, called into action for whatever needs there may be. At this stage, we continue to repeat, there should be only emergency and essential travel by our citizens outside of Trinidad and Tobago, and we just tell people to continue to exercise caution and personal caution at this stage. The good news, from what I understand from our health experts, having sat with them for the last 45 minutes, is this case there was pretty much immediate isolation, and we will just continue to monitor. And when the contact tracing takes place, as it has been done, and we get more information, we will take further decisions and announce them as necessary. I think at this stage, we will continue to keep you all informed as and when more information takes place or there's more information for us to provide. At this stage, we'll take a few questions. And I think we ask that you all move the mics down to the table so we'll be better in a better position to decide how it is answered. Thanks. There's absolutely no change. There's absolutely no change in the protocols. What it is you have different protocols for different steps, different stages. So we're just utilizing the protocols that are in place.
As far as contact tracing is concerned, the people that this gentleman would have come into the country with, have they been contacted as yet? What is the progress of the contact tracing?
Right. So the immediate contacts on the airplane, we are getting together a list of all the persons, and they will be contacted in very short order and isolated and or quarantined as the need requires. He started to experience symptoms not on the first day that he came, on Wednesday, which is when he would have contacted the healthcare provider. Sure. Sure. Basically, contact tracing is for persons that would have had any significant contact for any long period of time. On the airplane, we normally use 2 seats in front, 2 seats behind as a protocol. That is being conducted in terms of contacts. It has to be some significant or close contact. Generally speaking, it is good in this case because he would have self-isolated at home, so his primary contacts would have been the people that were in the household. From day one, he never moved away from the home.
So at this stage, we're not saying, yes, it is a person who resides in Trinidad who had business in Switzerland. The important point is that he basically self-isolated. So even before symptoms began presenting themselves, he took a decision not to go out to work, not to go out in public, not to put himself and the public at risk by doing that. And it worked out well in this instance, because by Wednesday, when he began to have the symptoms or feels ill, the public health system kicked in.
In this case, this patient, would he have presented himself to a health center?
No.
He did not leave home. This patient never left home.
Okay, so with that in mind, what is exactly the public protocol for someone who is at home in isolation and thinks that they their symptoms are
Yeah, so
Yeah,
so generally speaking, the protocol, as it has been for other diseases, is that you contact a health center or health facility nearest to you. If you have mild symptoms, if you have severe symptoms, you go in. You don't wait to contact, you go in and seek care. So the patient's actual physical state, it determines, whether you go in or not.
Okay, and if you have mild symptoms and you contact your health center, what is the next step if someone comes?
The advice is given either by the healthcare professional in the facility or by the county medical officer of health, determining your risk based on your symptoms, and they will advise.
Okay, so the advice to the public, just to be clear, if you have mild symptoms or if your symptoms are severe, you need to go in.
I just want to take a step back.
Okay.
All right? This is our first case to Trinidad and Tobago. It is an imported case. It was not acquired here. It does not change the way the population will be exposed to the disease in Trinidad. We are still relatively free of this disease, aside from this one imported case. So there shouldn't be a great concern of contracting it by the general population in terms of mingling. However, the advice we had given in the post-cabinet briefing still holds in terms of avoiding mass gatherings, sanitization of hard surfaces, washing hands, personal protection. Yeah. So the advice clearly is basically to contact your health centers or your nearest health facility, and the healthcare professionals will guide you based on your symptoms. I don't advise persons to think that you have a mild illness based on your own assumptions, and it turns out to be something severe. You need to contact someone that will be able to tell. Sure. I think the call is important to the CMOH or the public health facilities. They will determine risk and exposure. So I think that's important. Right. I mean, there's no way to tell in a population of any size if you have someone that has absolutely no symptoms, if they have a disease or not. There's just no way to tell. Of the persons that have presented to us, all of them would have had travel histories. Most of them, they would have had symptoms. Some they presented, we tested thus far 51 persons. This is the first positive that we have gotten. I think the surveillance at our facilities has been fairly robust, and we would have picked up most of the persons. He had no symptoms upon coming into the country. So he would not have had a fever. Even if you tested him with a tumor scanner, you would have gotten a normal result. It would have been done.
He said he resides in Trinidad.
No, I never said that. I just said he was a 52-year-old male. A 52-year-old male.
He said he resides in Trinidad and Tobago. We haven't checked all of that as yet.
This is new, it's evolving. We will get all those details. Let's see about handle that.
The lab results that I got today, I believe they have covered all the tests that we would have gotten into the lab for today. So I don't know that there's a test pending at this point to cover.
What his relatives said are in isolation?
Yes.
Correct.
Currently.
Well,
No.
as we found out on Wednesday, as we said, immediately upon the public health system becoming aware, they were put into quarantine as well.
But is that self-quarantine or quarantine as in Quora or?
No.
At their home.
At home.
Okay.
As we have done for other cases.
Okay, do we have a final question, please?
With news of this coming out, there's going to be an obvious amount of panic. So far, we've seen some panic buying at PriceSmart and other supermarkets and so on. As far as this one case is concerned, should the nation be at a heightened sense of concern over this? Could any of you point out
Right,
how concerned, how bad this could be?
Well, you can't point out how bad this could be. I mean, what has changed between now and the post-cabinet briefing a couple hours ago is we now have the presentation of the first positive case. What we continue to say is, fortunately, it was an imported case. There seems to be a significant amount of isolation around this person, but it continues to evolve. We certainly continue to tell people there is no need for panic. We're telling people just continue to use your wits about you, use your common sense, and at this stage there is nothing that is concerning us for us to take any further steps.
One more question. I mean, I know that this individual came through a legal port of entry, but there has been some concern, and also CARPA has advised that our greatest threat will be those coming through illegal ports of entry. Is there anything that we can do maybe from a national security perspective?
National security continue to do what they have to do to man our maritime borders. There has been absolutely no instance of that as yet, of any case coming through any illegal port of entry. In fact, one of the discussions we were having earlier is even at our legal ports of entry, stepping up the screening process at those legal ports of entry, meaning our seaports of entry as opposed to our international airports.
Okay, we have a next final question.
Yes, this final question. Just to piggyback off of my colleague's point there about people have already started to panic, and I just wanted to ask if our CMO minister could, for the viewing public that is watching this, I think the confusion that people are getting is with imported cases and community transmission.
Okay.
So if you could just explain that.
Okay. So let me start off by answering the final. I have been saying all along, there is a need for concern. There is a need for heightened vigilance, but there is never a need for panic. And it's a word which I think we need to expunge from our vocabulary right now. And I'm appealing to mainstream media not to use that P word. Because when you do that, you send subliminal messages to the public. We have been transparent. We have been honest from day one. There is absolutely no need to panic buy anything. The only area of concern for me as Minister of Health, as I've been saying, is our elderly population. Our elderly population, as I've been advising all along, need to take special precautions to self-regulate their activities in going out into the public, in attending large events, because the elderly population, when you look at the figures globally, they are the ones that carry the brunt of the fatality rates. And that is why at the post-cabinet meeting today, Minister Young outlined a moral suasion point that the population needs to take a look at itself and how we conduct our public business, right? So do things like washing off your hands. Don't touch your face. Don't do like me and after the postcap, shake the CMO hand by reflex. You know, cough into your elbow, you crook off your sleeve, wash your hands, wipe your hands when you touch hard surfaces. And I'll give you an example. You know what's the biggest danger to us now? This hard surface. When you touch it, you lend it. You know, when we take a call, we say, hey, take this call now, and then you put it back here. That is how the virus is transmitted. Cell phones, credit cards, keys, doorknobs, bank cards. So I am asking for social responsibility. Let's broaden that, and we will get through this together. It is not Armageddon. It is not a disaster. There is absolutely no need for panic, but let us be our brother's keeper in all of this, and together we will get through this. Thank you very, very much.
Thank you very much, ladies and gentlemen. Hey, very good, man.
And that was an update on the COVID-19 virus by the Ministers of Health and National Security. Now, the Minister of Health confirmed that at 2:45 p.m., CARPA confirmed its first COVID-19 case from a 52-year-old male. The minister said the case was imported. And of course, we will have more on this story in a subsequent newscast. I'm Mahalia Joseph Wharton. Have a good afternoon.